Good morning, everyone. It's 11:30, so we'll go ahead and get started. Good morning and welcome to today's webinar. I'm Colleen and I work in the marketing department at Armor. Thank you for taking some time out of your busy schedule to join us today. This is the first webinar we've done in this format, so if you have feedback or suggestions regarding the day of the week, the time of the day, or etc., let us know in the chat. We'd love to make future webinars even more accessible to more people. So again, if you have suggestions, please type them in the chat. If you're not familiar with how to use the chat, look for the conversation bubble icon, which is probably at the top right of your screen. Just click on that and it will show you the chat area. Before we get started, I want to mention that everyone is on mute. If you have questions, please type them in the chat and Dr. Vicky will address them. I'm also going to be sending out some poll questions here and there throughout the presentation. So we hope that you'll answer those and interact with us via those questions. So let's get started. Today's presenter is Dr. Vicky Lauer, and she is one of our on-staff veterinarians here at Armor Animal Health. So I will stop. Take it away, Dr. Vicky.
Hello, everyone. Colleen, can you see my presentation?
Yes, we can see you and the presentation, so we are perfect.
All right. So yes, my name is Dr. Vicky Lauer. I'm a professional services veterinarian with Armor Animal Health, where I've been working for the past 8 years. Just a little bit about me. I'm married to a farmer. I actually have dairy goats myself. So while I don't milk cows, I do milk dairy goats every single day. And today we're going to talk about selective dry cow therapy as it applies to today. And let me make sure everything's going to cooperate on my end. All right, so to start out with, we do have a poll right away. The poll question, Colleen, if you wouldn't mind bringing that up. Do I need to unshare?
Nope, I'm launching it right now, so it should pop up in a second.
Perfect. And yeah, the poll question is, we just want to know what's your role in the industry. If you're a dairy producer, I know there were some goat producers that had signed up. So yeah, if you're a dairy cow, a dairy goat, we had a few other options on there as well. And Colleen, I'm not able to see the results when they're done, so if you wouldn't mind just reading them off.
Yeah, right now it looks like we only have one answer. So hopefully it is popping up for all of you. We are using, this is a little bit newer technology, so bear with us as we struggle with it, struggle forward. It worked in our past seminars. So I don't know, maybe we can just keep moving on and come back to it later.
All right, sounds good. Yeah, because I'm seeing on my phone a dairy producer, a vet, and just another. So, all right, well, we'll try that again. If you see the chat on your guys's end, for me, like on my phone, I had to click on something. It says select a card. So not sure how that all works for you guys. Looks like we had a few more responses, so we'll just keep on going. Okay, so probably most of you know what a dairy cow is, but just wanted to clarify when we're talking about a dry cow, this is a cow that is in between her lactation. So she's already lactated once. She is currently not being milked, but she is going to be milked again. Why it's important to define that dry dairy cow has to do with some of our drugs, honestly. So if you look at some of the antibiotics especially, they'll say they're not to be used in lactating cows. A dry cow that is between lactations is still technically a lactating cow as far as the FDA is concerned. So those drugs that are specifically states on there not to be used in lactating cows, dry cows are not, we can't use those drugs in dry cows either. Dry cows, because they are not producing milk, they are oftentimes undervalued because we're not seeing any return on the feed that we're feeding those cows. So sometimes dry cows are kind of put in the back pasture, so to speak. They're ignored, and this is actually rather detrimental to not only the cow, but the calf that she is carrying. There's a lot of data that is showing that how we take care of that cow during the dry period will dictate her daughter's future milk production and health. So it is important that we focus on these dry cows and take as good a care of them as we can. Now, for most people, when you talk about a dry cow, she's going to be in that dry period for about 60 days. Some farms are shorter. 45 days is kind of the minimum. Some cows will be dry longer than 60 days, especially back when COVID first hit. A lot of farms were drying cows off early because they didn't want to sell those cows, but they needed to drop their production. And as we know, when the cow stands dry for a lot longer than that 60 days, there can be some health issues. When we're talking about a far off dry cow, this is typically a cow that's in that first 45 days of her dry off period. And then a close-up dry cow is going to be in that last 3 weeks before she calves typically. So dry cow therapy has been around for many years. It was developed in the past to help deal with some of our contagious mastitis pathogens. It's been very common with that dry cow therapy. What we're doing is we're infusing an intramammary antibiotic directly into the end of that teat to help kill off or treat any existing mastitis infections that might be present. We also do that to help prevent new mastitis infections that could occur during the dry period or shortly after she freshens. And then also by using these intramammary antibiotics, it will help decrease somatic cell count after she freshens, which is definitely a plus, especially if you are getting somatic cell count bonuses. And then they will also minimize clinical mastitis after freshening. Now, when we do treat those cows with an intramammary antibiotic, it's really only going to have an effect for the first 30 days of lactation. After those 30 days, then what we do after, once we're milking that cow, is really going to determine her mastitis rate and her somatic cell count. So when we're drying off those cows with those intramammary antibiotics, we're only really affecting the dry period and then the 30 days after she freshens. Okay, so we do have another poll. We'll see if this one works a little better. So Colleen, if you could bring that one up, please.
Okay. So we're doing the question, what's your familiarity? Is that the one we're doing, the next poll?
Yep. How familiar are you with selective dry cow therapy?
Okay, I just launched it. If you see it on your screen, please answer.
Basically, we want to know if you've never heard of it, if you've heard of it, but you haven't started doing selective dry cow therapy, if you're currently doing selective dry cow therapy, or if you used to do selective dry cow therapy. All right, we got a few votes. Looks like some of you have heard of it but haven't tried it, so that's perfect. Hopefully today will definitely help inform you more on maybe some pluses and minuses and how to go about that. Looks like we're still getting some answers coming in, right, Colleen?
Correct. Yep. Looks like 83% have heard of it but haven't tried it. And then we have 17% used to do selective dry cow therapy. So they did it in the past.
All right. So yeah, the bulk of you haven't tried it. So let's plug on through this and talk some more about selective dry cow therapy, what it is, and how you could potentially apply it to your farm. So selective dry cow therapy, it is a newer concept, but honestly, it's been done over in Europe rather more extensively than it has been here in the United States. Over in Europe, they are a lot more strict on antibiotic usage in certain countries. Some of those countries, only a veterinarian can give an antibiotic. And let's face it, if a veterinarian had to give every single dry cow tube, it would be very, very expensive. And then honestly, as a vet, I don't want to spend my day just dry treating cows all day long. So yes, a lot of these farms just switch to selective dry cow therapy as a way to minimize cost. So with selective dry cow therapy, what we are doing is that we are making a decision on each individual cow if we are going to treat her with that dry cow tube, that long-acting antibiotic, or if we're not. Regardless of if she gets an intramammary antibiotic, she has to have an internal teat sealant, no matter what. So if you guys walk away, don't listen to anything else, selective dry cow therapy, you have to use an internal teat sealant for success. So with those cows, like I said, we're going to try and decide, does she get an antibiotic tube or does she just get an internal teat sealant? If she receives an antibiotic tube, then she's going to receive an internal teat sealant as well. And we're going to go through the criteria that lets you decide if she's going to receive an antibiotic or not. So some benefits of selective dry cow therapy. The biggest one is it's going to reduce antibiotic usage by up to 55%. Now that can depend on the farm. So some farms, if they really aren't using very many dry cow mastitis tubes already, that number can be lower. Some farms can be as high as 85% reduction in antibiotic usage. This is very desirable to consumers because, as I'm sure you all have heard, there's a lot of concern about antibiotic resistance. So those bacteria that are naturally on our skin, that are in that cow's udder, they develop resistance to an antibiotic when they are exposed to an antibiotic. So by limiting antibiotic usage, we are able to decrease that antibiotic resistant bacteria. Another benefit of selective dry cow therapy is that it's going to reduce product cost because we're not using the antibiotics, so we don't have to purchase as many of them. And of course, right now with the shortage in those dry cow mastitis tubes, it's even more important because we just can't get a lot of these dry cow mastitis tubes anymore. So it will allow us to extend the product that we currently have available on the farm, just in case we aren't able to get as many of the antibiotic tubes that we would like. Now, there are some very specific criteria for farms that might be good candidates for selective dry cow therapy, because although it sounds great, you really have to have very specific criteria in order to try selective dry cow therapy and be successful. So farms have to have all of the following things there at the bottom. You guys can read, but I am going to read them off as well. So the bulk tank somatic cell count average has to be 250,000 cells per milliliter or less. If your average is above that 250,000, not going to be a good candidate for selective dry cow therapy. Some farms we actually go as low as 200,000. Now many farms are pretty progressive and they can hit that target. Another thing, we want to make sure that Staph aureus and strep ag, so those are two of our contagious mastitis pathogens, want to make sure that they are very well controlled. They don't absolutely have to be zero. So I do have a farm where, every now and then they get a Staph aureus cow, but they need to have a very good control program in place and also not have very many of those Staph aureus cows. You also really need a very well-trained dry off team. So this is a team of individuals who are very meticulous. They're good at cleaning off those teat ends, and we'll get into why this is so important. And then record keeping. Record keeping is critical for the selective dry cow therapy program to succeed, because we're going to have a lot of records on individual cows to be able to determine if she's or how she's going to get treated. But then also, once we start this program, we want to see if we're having success or if it's not working for us. So definitely have to meet all 4 of those criteria for this to succeed. Also, for selective dry cow therapy, we're going to need basically 3 things before we start the process. We need some bulk tank analysis, and this is going to let us see what the prevalence of those mastitis pathogens are. So that Staph aureus, that strep ag, those are the main ones that we want to see how prevalent they are in the herd. And the best way to do that is with the bulk tank analysis. We're going to need that internal teat sealant that I talked about. And then, of course, intramammary antibiotic tubes, because we still are going to use dry cow tubes. We're not getting rid of them completely. We're just limiting their use. Now, with the shortage of dry cow tubes, unfortunately, some farms have learned kind of the hard way that not all mastitis tubes are created equal. Some antibiotics are more effective against certain bacteria, especially the coliforms, versus other products are not as effective. So it's not one of those things where you can just switch to a different dry cow tube and not expect any negative consequences. Fortunately, we're seeing a few more coliform cases, so toxic mastitis, in some of these farms that are switching around. So it's very important that you do work with your veterinarian to decide which dry cow tube is going to be most effective for your farm. So with a bulk tank analysis, there are lots of things we can test a bulk tank for. Of course, you can test for fat and protein, the bacterial counts. For the selective dry cow therapy, we're really going to focus on these udder health or mastitis pathogens. That's the main thing we're going to look for. But you can look for other things as well, different foodborne bacteria, zoonotic bacteria. Those are bacteria that humans can acquire from that milk. And then some different viruses like BVD, BLV, Johne's, those sorts of things. So with that bulk tank analysis, we're going to use that kind of as a snapshot to see what udder health is looking like across the whole entire herd. So it lets us get a picture of what's currently going on in the herd. And then if we do these bulk tank analyses regularly, we can get a history of what has been going on in that herd. It's a lot less expensive than doing quarter milk sampling on the whole herd, because with that bulk tank sample, we're just collecting milk from all those cows, a very small amount of milk from all those cows, and pooling it all together, versus that quarter milk sampling, you're pulling a sample from every single quarter of every single cow. So yeah, it gets very expensive doing quarter milk sampling. Bulk tank analyses are quick as far as getting those results back, typically in a couple days. And then if your herd is having any sort of milk quality issues or any sort of mastitis issues, we're going to want to do a bulk tank analysis kind of as the first step to see what's going on. Now, with the bulk tank culturing or testing, there are certain limitations to what we can and cannot do with it. So we can't extrapolate that data or that information to an individual cow level. So let's say that we do a bulk tank analysis and the main mastitis pathogen is Staph aureus. Well, we cannot say that every single cow that has mastitis on your farm has Staph aureus. It doesn't work that way. With that bulk tank milk analysis, we're just looking at what are the main pathogens that are present in the whole entire herd. Ideally, we like to take 3 or more bulk tank milk samples, and these would be serial milk samples. So you take a sample from bulk tank on day 1, another on day 2, 3. I ideally like to take samples from 5 individual days, and we want to try and capture that milk from all the cows that are currently being milked. It does, when we do receive these results, we do have to have some information about how the herd is managed in general in order to interpret them. So working with your veterinarian to see how those bulk tank results fit with your herd is ideal. It's very important that we take proper samples, and I'm going to go through how to take those samples. And then also the larger herds, so 1,000, 2,000, those sorts of animal numbers, it's a little harder to interpret bulk tank cultures. And that's simply because of dilution. Not sure if you've heard of the solution or of the saying that dilution is the solution to pollution. With that, if we have one cow that's shedding one of the contagious mastitis pathogens in a whole herd of 3,000 cows, that just gets diluted out a whole lot more. Versus in a smaller herd where that one cow, more of her milk is going to be in a greater proportion in that bulk tank, if that makes sense. So on larger herds, honestly, instead of doing bulk tank cultures, a lot of times we'll do bulk tank PCRs because that allows us to pick up on even smaller numbers of bacteria. All right, so Colleen, I believe we have another poll. This one is, do you currently perform milk cultures? So I'll give you guys a few minutes, or a few seconds, I should say. Vote on that. All right, and some votes are coming through. Looks like some of you do milk cultures on individual cows, some do bulk tank and individual cow cultures, and some of you don't do any culturing. Give everybody a few more seconds to vote. All right, I'm not seeing any new votes popping up. Are you, Colleen?
Yep, I am seeing. So at this point, we have 33% individual cows only, 50% bulk tank, and individual cows, and 17% aren't doing any at all at this point.
All right, sounds good. All right, so yeah, in a perfect world, we would like to take both individual and bulk tank cultures. Those individual milk cultures are going to let us know how we should handle each individual cow. And then, like I said, the bulk tank milk cultures are going to be kind of whole herd. So I'm glad that quite a few of you are doing that. For those of you who have not done any sort of culturing, we are going to go through the culture process for both the bulk tank and individual. I'll do the individual milk culturing closer to the end. So for doing that bulk tank culture, when we're collecting that sample, ideally we want to wait at least 1 to 2 hours after milking, again, so we can capture more of those cows. In a perfect world, I like to wait until all the cows have been milked and they fill up that 1 bulk tank or 2 bulk tanks, depending on the size of the herd. It's not always possible. And again, that's why we will take multiple samples from multiple days, so that we can get hopefully a picture of all the cows that are currently milking. And then it's important to do these routinely. I say quarterly minimum, because then we're going to be bringing in those dry cows, those heifers that are freshening during that time span as well. All right, there are some containers that you should and should not use for collecting these milk samples. So over on the left, those are good containers. The one on the far left, that's your typical milk culture tube. It's a perfect sterile sample. You can close that lid afterwards. There's a centrifuge tube there on the left. Those work well. Things that you should not use, so just a syringe. Yes, the syringe is sterile, but they leak. And so if we're sending a sample to the lab in a syringe, most likely it's going to leak out. And then if it leaked out, then the lab can't test the milk samples. Reused plastic jugs are also not a good option, just because there's going to be a residue of whatever was in that jug, which can affect the bulk tank milk culture results. And then of course, glass jugs or glass tubes in general, not a good idea because they're more likely to break. So as far as collecting that sample, we want to agitate that milk for a full 10 minutes just to make sure that the milk is homogenized and well mixed. And then we're going to get 2 ounces of milk from the top of the bulk tank, not from the bottom spigot, right from the top, using a clean and sanitized dipper. So it can't be that dipper that's been sitting on the ladder that, you know, maybe has gone through the rinse water once every couple months. And that, it needs to be a nice, clean, sterilized dipper. You want to note the temperature on the bulk tank. Ideally, we don't want to take samples from milk that is warm because, again, bacteria are going to grow faster and it's going to alter our results. You want to label the sample with the date that that sample was taken, your farm name, and then transport the sample on ice to the lab as quickly as possible. So some different bacteria that we will find on the bulk tank mastitis cultures. Basically, we break them down into 2 groups, contagious or environmental. Our contagious bacteria is typically going to be our Staph aureus, our strep eggs, mycoplasma, and then prototheca. These contagious bacteria are transmitted from one cow to another and also from one quarter to another during that milking process. The reason why we post-dip is to actually hopefully minimize the spread of contagious mastitis pathogens. And then for our environmental mastitis pathogens, the big ones are going to be the different streps, the Klebsiellas, Enterobacter, and then of course E. coli. Because these are environmental, as the name implies, they typically come from the environment. So these are going to be cows that are contaminated in between milkings, typically from lying down in the stalls, manure splashing up on those udders while they're walking around, the bedding, like Klebsiella, really like it grows very, very well in sawdust or certain sorts of paper bedding. And we'll see more of these mastitis pathogens depending on the stage of lactation. So in that early dry period, we're more likely to see the streps, the klebs, the enterobacters, and then around calving, so right as she freshens or even before she freshens, we can see more of that toxic mastitis, those E. coli's. Okay, so internal teat sealants. Why is an internal teat sealant so important? Because I said we absolutely have to have an internal teat sealant. External teat sealants, they do not provide enough of a barrier to keep those bacteria from climbing up into the udder. We need that internal teat sealant because, as that picture shows on the top, that teat sealant is going to stay in the bottom of the teat, and it's going to form a nice thick plug that bacteria cannot ascend through. Versus those external teat sealants, it's very easy for bacteria to get through them. And also, if that cow, she didn't dry off very well and then she starts leaking, well then her teat end becomes open. There's no plug in there if you just use an external teat sealant, and those bacteria can just climb right back in. Now, if you're not familiar with internal teat sealants, these are not antibiotics. So it's a bismuth solution. It's very thick. Typically it's white, although there's some different colors now. And like I said, it's just going to seal those teat ends. If we are using an antibiotic tube, what we would do first is we would prep that cow just like you would for drying off a cow, making sure those teat ends are nice and clean. We'd infuse that antibiotic right into the end of the teat. Massage the antibiotic up into the udder, massage it very well to try and get that antibiotic to spread throughout the udder. We'd re-sterilize the teat, then we would infuse that internal teat sealant, and after you infuse that teat sealant, you do not massage the udder. We want that teat sealant to stay right in the bottom of the teat because that's where it's going to do its job of protecting the teat end from that bacteria climbing up in. And then of course we're going to post-dip the cow as well. The nice thing about these internal teat sealants is they don't have a milk or a meat withhold if they're used on their own. If you do use them with an intramammary antibiotic, then you would have to follow the antibiotic meat withholds. Some milk plants actually really don't like internal teat sealants. Used to be really bad, so some plants actually prohibited internal teat sealant use. Nowadays, most of them are pretty good about it. The reason why is that if the internal teat sealant isn't properly milked out, it can clog filters, and if it gets through a filter, it can actually get into the cheese, and that cheese will have a very odd looking white spot. It doesn't hurt people, but it's not cosmetically appealing. So yeah, I think, like I said, nowadays most of the cheese plants have found a way to deal with it, and they don't have any concerns with their customers using those internal teat sealants. When that cow, after she freshens, if an internal teat sealant was used, it's important to hold off the top of that teat and then strip her out because you don't want that teat sealant going up into the udder. It's when that teat sealant goes up into the udder that it is more problematic to remove. We do recommend typically bucket milking these cows for 3 milkings if you use an internal teat sealant, and of course that milk can be a great option for colostrum and then transition milk for those calves. Okay, so I talked about the things we need before we do selective dry cow therapy. Now, how are we going to actually implement selective dry cow therapy? So on your farm, there are 2 ways of deciding which cows are going to be treated with an antibiotic and which cows are not. The first option is called an algorithm-guided method. So with this, we're going to use that monthly DHI data to make that decision. So if your farm is not using, if you don't have monthly DHI data, this algorithm guided method is not going to be the route to go. Unfortunately, doing like a CMT every month, that's not sensitive enough. We really need that DHI data. So cows that are going to be enrolled in the selective dry cow therapy program, so these cows are just going to receive that internal teat sealant, they must meet all of these criteria. Their somatic cell has to be below 200,000 for the entire lactation. If she spiked above that, then she doesn't qualify for the selective dry cow therapy program. She has to be free of clinical mastitis, so chunks, watery milk, nothing like that, for 14 days from when she's going to be dried off. And then she can have only had 1 clinical mastitis case during her entire lactation. Some farms have actually been strict enough where we said, nope, if she had 1 clinical mastitis case, she's going to receive an antibiotic regardless. So this can be kind of up for debate. You can work with your veterinarian, and if you're going to decide to treat those cows if they had mastitis or not, as far as dry cow treatment goes. So if a cow meets all of those above criteria, then when she's dried off, just an internal teat sealant would be used. No intramammary antibiotics in any of her quarters at all. Now, if she does not meet one of these criteria, so if her somatic cell was higher than 200,000, if she had mastitis before dry off, or she had more than 1 mastitis case during her lactation, then she would receive that dry cow antibiotic tube in all of her quarters, followed by an internal teat sealant in all of her quarters. Okay, so the second option is called a culture guided method. So this would be for farms that do not have DHI data, or if they are doing culturing, maybe they want to go with this route. It is a little more expensive because you're using either on-farm or diagnostic lab culturing on each individual cow. So 2 days before dry off, you would collect and culture a milk sample from each of those cows that needs to be dried off. You can do a composite milk sample where you take a little bit from all 4 quarters and combine it into one sample, or you can do an individual quarter sample. So you test each individual quarter separately. It's kind of up to you on which route you want to take. If you do a composite milk culture, so all 4 of those quarters are combined into one sample, if she has any sort of growth, doesn't matter what sort of bacterial growth it is, if there's growth on that culture, then all 4 quarters are going to be treated with that dry cow antibiotic tube and that internal teat sealant. If you're doing quarter samples, and you get a positive culture on one of those quarters or 2 quarters, whatever, you would only treat the quarters that had growth with an intermammary antibiotic and an internal teat sealant. If the composite milk sample is negative or any of those quarter milk samples are negative, then those quarters or that cow, the cow would be if you did a composite milk sample, the quarter would be if you did a quarter milk sample. Those individual quarters of that cow would just be treated with an internal teat sealant, and she would not receive any sort of intramammary antibiotic. So hopefully that makes sense. Like I said, it is a bit more expensive going this route because there's a lot more testing involved. Regardless of which option you use to try and decide which cows are going to go into that selective dry cow therapy option, it is very, very, very important that those teat ends are clean and sterilized before we insert an internal teat sealant. Because we're not using as many antibiotics in these cows, if we take any bacteria up into that teat end, the cow has no protection besides her natural defense. There's no antibiotic in there. So those teat ends have to be clean and sterile. And that's one of the maybe the downsides of this program is that if your dry cow team isn't super great about keeping those teat end cleans at dry off, maybe this program isn't the best for you. It's definitely a good idea to work with your veterinarian at all times before implementing this. Okay, so there have been several university studies, both from the US and then Europe, looking at the results of selective dry cow therapy. And they found that there is 0 difference in intramammary infection at calving when an internal teat sealant was used. So when they're using either the algorithm-based method or the culture-based method, there was 0 difference between cows that received an antibiotic and cows that received just that internal teat sealant. However, if an internal sealant was not used, then the mastitis rates were considerably higher, which is another reason why I said we have to use that internal teat sealant no matter what. There are a lot of different resources out there, a lot of different studies. This is just one study that's been fairly recent that did a very large comparison of a lot of cows. So some really good data there. Okay, so I talked about how we decide which cows we're going to treat, but now I wanted to go into how do we do on-farm culturing. Many farms have kind of gone this way for many reasons, not only for selective dry cow therapy, but also for figuring out which cows should be treated with which antibiotic tubes during the lactating period. So there are some things we need before we start on-farm culturing. So we need a clean area that we're going to be able to actually set up these cultures. You're going to need an incubator, some supplies, which we'll go through those. You need accurate records just with selective dry cow therapy. We need to keep track of those animals as far as who's been treated, what growth there was, that sort of thing. And then for employees that are doing this or even owners that are doing culturing, it's important to do training. That way everyone knows exactly how it's done because it is very much a stepwise process. All the steps need to be followed well and have a lot of attention to detail in order for on-farm culturing to succeed. Okay, for that clean area, Ideally, we want a place where there are no food, no beverages, because we are going to be dealing with bacteria. We don't want to introduce those into somebody's lunch. We want an easily disinfected counter, so something that's non-porous that we can wipe with a disinfecting wipe or some rubbing alcohol to clean up that surface. We want good lighting so we can actually see what we're doing. Ideally, having a sink or some hand sanitizers nearby so we can keep our hands clean throughout the process. That's perfect. And then we do want it temperature controlled because bacteria are only going to grow at certain temperatures. So we can't have this out in the barn where it's 20 degrees in the winter and 90 degrees in the summer. There are a few different incubators that you can use for on-farm culturing. One of the more common ones is your typical egg incubator, which is there on the top. The nice thing about these is that they are very inexpensive. They're easy to come by. Lots of places carry it. The downside though is they're hard to clean, and because they're styrofoam, they can get kind of skunky because bacteria prefer a slightly humid environment. So we'll typically have a small dish of water in that incubator when we're doing some cultures. So yeah, they're very hard to clean and they can get pretty nasty, both smelling and looking. So we typically have to replace them more frequently. The incubator at the bottom, this is a Jorvet incubator. There are a few others out there. This is a very nice professional incubator. So it's what a lab would use. It's a lot easier to clean because all the surfaces can be wiped down, disinfected. The downside though is that it is more expensive, but this is kind of an investment. If you're going to do on-farm culturing, this investment is going to last a lot longer versus your typical egg incubators. So different supplies you're going to need some cotton tipped applicators. We're going to use those for applying the milk to the actual media, the plate that we're going to grow the bacteria on. We're going to need those milk vials to collect our sterile milk samples. And then we're going to need some sort of culture media, some sort of plate. There are a few different ones out there. So a newer one is this Minnesota Easy Culture Quad Plate with forecast media. This particular one is specific to selective dry cow therapy. Otherwise, you can use a biplate or a triplate. Those can be used for selective dry cow therapy as well as your regular milk culturing. AccuMast or AccuTreat, those are a few more options. AccuMast is a plate that's very similar to a triplate, but it has a color change in that media, so you are able to identify the bacterial strains a little better versus that biplate or that triplate where you can just tell if it's a staph, a strep, or a gram-negative. We are going to need some gloves because we're going to try and keep this as sterile as possible, so the gloves are essential. So sampling the cow, we need to get some milk from the cow in order to test it, to culture it. So we want to sample her before milking when she has a full udder. That way we're more likely to get those particular bacteria that are in her milk. We want to sample them in a clean location, ideally in the parlor, because the parlor, of course, is being cleaned 2 to 3 times a day versus a barn, which isn't quite as clean. And there's a lot more going on in that barn with manure splash and cows moving. We want to make sure that we can minimize any sort of contamination of our milk sample. So very dirty udders, they're more likely to lead to contamination of that sample. So cleaning off those udders before we sample them, flaming the udder to get rid of any of that hair, and then cleaning off the debris and manure that might be on there is going to give us a lot better culture results. Of course, those tails are annoying. There's not a whole lot we can do about those tails, but while you're taking that sample, if your hand gets bumped by a tail, you do need to note that, yep, possible contamination. Making sure that you're using gloves and then even sleeves to cover your arms so that no bacteria from your skin is going into that milk sample. And then using clean alcohol swabs when we are prepping those teat ends for that sterile milk collection. I can't tell you how many times I've gone and seen where they're just reusing that same old alcohol swab and it's nasty and disgusting. That's not killing anything. We need those clean, pristine, nice white alcohol swabs so we can get a good sample. Once we collect those milk samples, which I will show you how, we want to chill them immediately, ideally within an hour. So you don't want to go and collect milk from 30 cows and then just have it sitting out in the barn. We do want to have those samples chilled. You can freeze these samples and then thaw them to test them later. And I always recommend saving samples and freezing them in case we need some confirmatory testing. Okay, so this is how to collect an actual sterile milk sample. First, going to wash your hands, put on some gloves. We're going to label the sample vial with the cow number. If we're doing quarter milk samples, then we want to label if it's from the left front, the right rear, etc. We want to clean off that udder as much as possible. So brush off any manure, any dirt, any hair that could fall down into our milk vial, and then pre-dip those teats just like you would before milking. Leave it on for at least 30 seconds. A minute would even be better, honestly. If those teat ends or the udder is super dirty, we do need to clean them up beforehand before we're going to continue with the next step. So after everything's clean, that pre-dip has sat on there for at least 30 seconds. We're going to wipe each teat dry with a single-use paper or cloth towel. Very important that it is single-use, so we're not transferring bacteria from one quarter to another. Make sure that that teat end is completely dry, because that teat dip, it is a germicidal teat dip. That means it's going to kill any bacteria. We don't want a little drop of teat dip at the bottom of the teat that could then kill the bacteria in the milk sample that we're trying to gather. So then you're just going to strip about 3 to 4 streams of milk just to get rid of any environmental bacteria that are sitting kind of at the bottom of that teat end or right in that teat sphincter. And then scrub those teat ends with the alcohol. So either the wipes, you can use a gauze pad, you can use a cotton ball, it doesn't matter. But we want to make sure that that very end of that teat is clean. And so you keep cleaning until that wipe comes away perfectly white. Sometimes you gotta work quite a bit to make sure that that teat end is clean, but if it's clean, then we're gonna have a lot better results. Otherwise, if it's contaminated, you gotta go and repeat the process in a couple days after you saw that your culture is contaminated. Want to make sure that the alcohol is also dry on the bottom of that teat end, because alcohol is going to kill bacteria. That's the whole reason why we prep with alcohol. We don't want that interfering with our milk sample. Then you're going to open that milk vial and ideally hold it at about a 45-degree angle to the cow. And that's just to keep any debris from falling directly into that vial. Then you're going to kind of tilt that teat and squirt in. One thing I forgot to mention when we are prepping, so that very final step with that alcohol prep, we want to prep those furthest teats first and then do the ones that are closest to us. So if you are collecting milk and you're standing at the back of the cow, you would prep the cow's front teats first and then her back teats. If you're standing on the side, like in this picture, you would first prep those further away teats and then those closer teats. But when we collect that milk sample, we do it the opposite way. So we collect milk from those first teats, the ones closest to us, and then the ones furthest away. And that's just so we're not brushing the teat ends with our arms, basically, and contaminating those teat ends after we've already prepped them. So we're going to squirt some milk into that milk vial. The milk vial, you do not need to fill it full because you only need a very small amount of milk in order to sample it. And then close that lid right away and go on to the next teat. And yeah, then basically we're going to set them up for culturing after we've either put them in the fridge or we've frozen them. So for those different plates or the different culture media, it's very important to watch those expiration dates. So some products have a pretty short expiration dates, others are a little longer, so something to watch for. The plates need to be stored upside down in the fridge and in the incubator, and that's just to keep water from condensing in the top of that lid and then dripping down onto the plate, which would keep our bacteria from growing. The plates cannot be frozen. So the milk samples can be frozen, but not the plates. All right, and I have a video that I actually want to show you as far as how to do the plating. So we are going to see how this works. You will just give me a second. I'm going to get this YouTube video going. This is from Dr. Pamela Ruig, who is the kind of the main mastitis guru. So we'll listen to her. And Colleen, if you'll let me know if you can hear, that would be great.
And the first step is to label the agar dish with the cow ID, the quarter that's affected, and the date that we're setting up that sample. Make sure you don't label the bottom of the plate or write all over the top of the plate. In fact, it's best to write on the sides of the plate, because when we're identifying growth 24 hours later, those marks can sometimes obscure growth or make it difficult to read the plate. After we have the plate labeled, we want to mix our thawed sample by inverting it several times. The purpose of mixing this sample is to make sure that the bacteria in that milk sample are evenly distributed, so that when we dip our swab into it, we have a good chance of catching them. We then take our sterile swab, we dip it into the milk, and we leave that swab in there for about 3 to 5 seconds so it has time to absorb the milk. We then take the swab out and gently spread that swab over the top of the agar segment of the culture plate using the technique that we're showing. Our purpose of gently distributing that milk across the top of the agar is to be sure that we can spread out any bacteria that happen to be in there so we can identify them after the incubation period. Now, regardless of what type of plate you're using, a biplate, a triplate, or a quad plate, for example, every time we inoculate another segment of that plate, we'll dip the swab again, let the milk absorb, and repeat the process for each section separately. After each section of the plate is inoculated, we immediately cover the plate and lay it flat for about 5 to 10 minutes to let the milk absorb into the media. After the milk is absorbed, we're ready to put it in the incubator. And there's only one tricky thing to think about with incubating these plates. We want to make sure we place the plate in the incubator upside down. The agar side is on the top, the lid is on the bottom. That sounds counterintuitive, but the reason for that is to prevent condensation from forming on the lid and dripping on the agar and causing the bacteria to flow all over the plate. So be sure to place these in the incubator upside down. We then incubate it. Make sure you check the temperature of your incubator. It should be approximately body temperature, which if you have a Fahrenheit thermometer is about 98.6, or if you have a Celsius, it would be 37 degrees. And we'll leave it in there for 24 hours. Make sure you don't read them too early. The bacteria really need a minimum of 24 hours to grow. We'll talk about reading the plates later, but we have to come back to what to do with that milk sample. We really recommend that you take that milk sample, immediately put the lid back on it after inoculating the plate, and throw it in the freezer. You may need that milk sample to submit it to a reference laboratory if you can't arrive at a diagnosis and you need another opinion. And then finally, after you're all done inoculating all the plates, take your disinfectant wipes or gauze swabs and alcohol, and again, make sure you clean up your workspace.
All right. Go back to my presentation. Hopefully. And sorry, it went back to the beginning. Can you all see my presentation again?
Not yet.
Okay, let me try again. How about now?
Yes, we're good.
Okay. All right. So like Dr. Ruig had mentioned, we want to leave those plates in the incubators for at least 24 hours. With some of these, it's actually better to wait 48 hours. So just wanted to mention that. So once those plates have sat in the incubator for 48 hours, then we're going to read those results and see what we get. And I wanted to show you some examples. So this is that Minnesota quad plate, that forecast. Now this is just going to tell you if she needs to be treated for mastitis or not. This one isn't going to tell you as much as far as which species, if it's gram-negative, gram-positive. It can be an indicator of some Staph aureus, although not 100%. So on the left side, this is actually an example of no growth. There are some clumps kind of in the upper right, but those are actually milk solids. So whether the milk got sampled a little too heavy or just the fat and the protein kind of settled out. Versus on the right side, in that upper right quadrant, that's an example of a bacterial growth. On the bottom left side, that again would be milk clumping. So those bacteria, they form these nice distinct colonies. You can see those those clumps all throughout where that milk was spread out. And then you can also see how there's a whitish film all around those colonies as well. So those are indicative of growth. If we had done individual quarter samples on a cow, then whichever quarter corresponded to the upper right, that quarter would need to be treated with an intramammary antibiotic as well as an internal teat sealant, while the other 3 quarters would only receive that internal teat sealant. Now, if we did a composite milk sample, which you can do with these plates, so you can take composite samples from 4 cows, plate them all on one plate. Only the cow that corresponded to the one on the upper right would need to be treated with an antibiotic as well as an internal teat sealant. The rest of the cows would just receive that internal teat sealant. Okay, just a few more examples of the quad plate. On that sample on the left, in the upper left, that is suspect for Staph aureus. Now we would need to actually take those colonies off and grow them on a regular plate to confirm. If this was, well, I would assume it's not all from the same cow. This is probably 4 different cows. 3 out of those 4 cows would need to be treated with that intramammary antibiotic. And then on the right side, that's actually an example of contamination on both that upper left and those upper and the lower right quadrant, sorry. So if you look real closely, I'm not sure how well you can see it, depending on if you're looking on your phone or a computer, but on both of those samples, there are different size bacterial colonies. So some colonies are bigger, some are smaller, some have that white film around them, some don't, especially on the bottom. You've got maybe 3 different color colonies. That would be indicative of contamination. So if you had that growth on a cow, you need to go back to that cow, prep her again, do that full sterile culture, collect another milk sample and try again. I said you can also use a biplate, so this is just examples of growth on a biplate. On the left side, this would indicate a gram-positive bacteria. We don't know if it's a staph or a strep. On the right side, this would be a gram-negative bacteria. With this, we don't know if it's an E. coli or a Klebsiella. Now, Staph aureus with these biplates can be a little easier to see because of this zone of hemolysis. So if you look on the left side on both of these plates, instead of there being bright red around the colonies, there's that zone of either yellow or clear. If you held this plate up to the light, you could actually see through it. And that's pretty indicative of Staph aureus. Triplates, these are going to tell you if it's a staph, a strep, or a gram-negative. If it grows on both of the darker red sections, it's most likely a strep, versus if it just grows on that bottom section, it's usually a staph. On the right side picture, because there's no zone of hemolysis, this is probably just a different strain of staph versus Staph aureus. And then I touched on the AccuMast and the AccuTreat and wanted to go through those briefly before we end. These have a color change, like I said before, that will let you hopefully determine at least more closely what type of bacteria it is. So it's like a triplate where you have gram-negatives, you have streps, and you have your staph plates, or staph sections, sorry. On that gram-negative section, if it's a blue, if it grows blue, the colonies grow blue, it could be a Kleb, an Enterobacter, or a Serratia. Pink colonies are usually going to be E. coli's versus white colonies are Pseudomonas. And then streps, you can determine if it's a Uberus, if it's an Enterococcus, or even a Lactococcus. And then staph is pretty easy to tell. Staph species, which are white, versus Staph aureus, which is pink. And then some Staph hemolyticus as well. The downside of the Acumastes are more expensive plates because you're getting a lot more kind of bang for your buck, but wanted to share it as an option. And then there is AccuTreat as well, which just came out fairly recently. This is a quad plate, but it has the same media on all four sections. And so with this, you can test either 4 cows or 4 individual quarters for gram-positive pathogens only. So this isn't going to grow any gram-negatives. It's just going to be gram-positives. And there are some flow charts for the AccuMast that kind of let you help differentiate what those different bacteria are by their growth. Okay, I said records are critical, whether we're doing selective dry cow therapy or whether we're doing on-farm culturing. We want to make sure that we record the animal ID, the date that the sample was taken. If we are culturing for mastitis, she has clinical mastitis and we want to see what it is, we need to mark those affected quarters. Or if we're doing this for selective dry cow therapy, we want to know which quarters had growth. And then we want to state on our culture results if she's gram-positive, if she's gram-negative, that there was no growth. If it was a contaminated sample, then we need to redo those. And then if we're able to identify the specific bacterial species, making sure that you indicate which species grew. And then of course, if we're doing selective dry cow therapy, we need to state whether she received an antibiotic tube and an internal teat sealant or just an internal teat sealant. If we're doing this for clinical mastitis, then of course, which tube. And even with dry cow, it's important to indicate which antibiotic tube she received. All right, and just some quick references of some of those pictures. And I believe that is it. So what questions do you all have for me now?
We did get a couple questions through the chat, so I'll read through those real quick. The first one is from Keith, and he asks, why do you have to use the internal sealant versus using a protective post-dip? So again, why do you have to use the internal sealant versus using a protective post-dip?
Yep, so good question. So that protective post-dip, that is only going to kill the bacteria on the surface of the teat for, the longest it's going to last is maybe 45 minutes. And I'd say that's even stretching it. And that would be with something with a lot of emollients, really high iodine. Most of the time your iodine is going to have a really quick kill and it's going to be gone. There's nothing else there. So it's going to kill what's on that it's going to kill the bacteria that is on that teat right away, but it's not going to prevent any bacteria from going up into the actual teat canal. And that's where those internal teat sealants, they keep those bacteria from ascending into that teat canal. Then, like I said, same thing as with our external teat sealants. Those are just on the surface. They don't keep those bacteria from climbing into that teat canal. So good question.
Okay, we have one more from Oscar. He asks, many milkers are confusing internal teat sealant with signs of clinical mastitis. Would it be possible to add a color to it?
Yeah, so Lockout is actually one of the internal teat sealants and it has a blue dye. So it is actually addressed that. So that's a good option to use. As far as adding a dye to a teat sealant that you already have, that I wouldn't do because then you're more likely to introduce bacteria if you were adding a colorant to that. So yeah, it's definitely a problem in the industry that's been addressed. Like I said, it's very important after that internal teat sealant is infused that they do not massage that udder and massage that internal teat sealant up into the udder. You want to make sure it's the last step they do before they post-dip and just leave that internal teat sealant where it is. And then when it's time after she freshens, clamping off at the top of the teat, right where it attaches to the udder, holding that really tight, and then actually squeezing it out while keeping this clamped off. That's one of the best ways to keep that internal teat sealant from climbing up into the udder as well. So not just doing your typical strip, because when you strip, sometimes it can that teat sealant can slip up on the sides. So really clamping off tight and then squeezing. Because I milk goats, I have to do that every single day. You can't strip goats like you do cows. So it is a little different motion, but certainly something that can be taught. Good question.
Going back to Keith, he has a follow-up question. What about a T-Hex dry teat sealant that has protective post-dip that seals the outside of the teat?
Yep, so that would be that external teat sealant. Again, they found with the studies that they don't work. If you don't use an internal teat sealant, your risk of mastitis on those dry cows goes through the roof. So yeah, they've tried those external teat sealants and they just don't work. So if you're going to do selective dry cow therapy where you're not using an antibiotic on those cows, they gotta have that internal teat sealant. So yeah, it's a good question. I'm not making it up. You can look at that resource I sent, or there are a few other references as well where they've looked at that. And yeah, if you don't use an internal teat sealant, it just doesn't work. Not an effective program.
So we do have another question that came in from Erica. She says, we do an on-farm sampling. Can Armor do a follow-up video on reading tri-plates, or do you have another option for training?
Yeah, so the Minnesota, so they're the ones who actually make those tri-plates. They have some really good, it's a pamphlet or a handout that you can find online, and it will actually show you based on what grew, what species of bacteria it is, whether it's a staph, a strep, or a gram-negative. They have some really good resources as far as setting up those plates, again, reading them. So that video I showed you of Pamela Rueg, she has a whole series on YouTube as well. And then I thought we used to have some mastitis videos through Armor, used to be called Animart. So yeah, I'm sure that's something that we can provide you some good resources for.
Yeah, and that's a good point. We did record this video, and if anyone ever has any additional questions that you'd like to get to our vet team, please talk to your Armor rep, or just look at our website and send us an email, and we can get you, the rep can work with our vet team to get an answer on some of your technical questions. So with that, I think we are wrapping up. We are out of time. So we really appreciate Dr. Vicky for talking with us today and training us on selective dry cow therapy. As I mentioned, we did record this video, so we'll be getting that out to everyone, sharing it on our YouTube page, and distributing it that way. So if you or anyone else on your farm or on your team wants to watch it, we will be able to give you access to that. I also shared a couple resources in the chat, including the link to our selective dry cow therapy technical bulletin, as well as the page on our website that tells more about our vet services team and how we can help you and your herd health and profitability on your farm. So with that, any other final comments, Dr. Vicky, before we leave?
Nope, just thank you all for coming, and hopefully you found this informative. Oh, did you have one more poll, Colleen?
Oh, yes, you're right, I did, and I totally forgot to do it, and I will quickly send that out. We'd really appreciate if you answer this last poll question. And again, if you have suggestions on other topics that you would like us to address in future webinars, please let us know. Let your, if you have an Armor vet, let them know, or let your sales rep know, and we would love to hear your feedback. So give a second. And again, thank you, Dr. Vicky. Thank you all for taking time to join us today. And we look forward to chatting with you again sometime in the future. So have a great afternoon. Bye, everyone.
Bye.